Welcome to our Healthcare Workforce webinar series, where we explore the innovative ways communities are supporting those who care for us. In every strong community, care extends beyond the hospital walls. As healthcare demands grow, so does the need to support those who care for us. Today, we're joined by Dustin Wright, CEO of Floyd Valley Healthcare, to share an exciting step forward, the decision to open a new childcare center. Powerful partnerships and a shared community vision led to the creation of the Crittenton Childcare Development Center, a vital step in supporting our healthcare teams and their families. Can you tell me first a little bit about Floyd Valley Healthcare and how you came into your role?
Yeah, Floyd Valley Healthcare has been serving the needs of the community within Plymouth County, the only hospital in the county. We do have outreach clinics in Remsen and Marcus. And this organization has been in existence since the early 1900s.
Wow.
It became a municipal hospital with the city of Lamar's around the 1950s timeframe. 1956, I believe, is the exact year. And since that point in time, it's evolved tremendously over the years, continued to grow. We've just been really fortunate with the mantra is that we're doing everything possible to keep healthcare local. And so that means robust family medicine practice, of course, hospital bed, acute inpatient care, very busy surgical programs, specialty clinic programs, and everything in between, therapy departments. Of note, we just built and finished a new OB program. Over the past 5 years, we've had about over $20 million worth of capital expansion work. And so as the community grows, we grow, and we just look at ourselves as a vital partner in the Lamar's and surrounding communities.
Fantastic. Sounds like you have a large stake in the community itself. How long have you been in your role?
Yeah, thank you. Yep, so I've been in this role 6.5 years now, and just love it, great community, and it's been a really good fit.
Are you from Lamar's originally?
I grew up on a farm northeast of Primgar, Iowa, which is only about 45 minutes away from here. Northwest Iowa has been home for me for a long time. My career has taken me throughout the Midwest, but a lot of that time prior to Floyd Valley has been in the state of Iowa. Have spent some time outside of the state, but again, just feel really fortunate to be in this role.
What has kept you in Iowa, in your role?
Professionally, this is just a very strong organization. We've got a great board of directors that I work hand in hand with. We've got an amazing team here. We've got over 400 team members, and it really just feels like home. And the work that we do is 100% supported locally through our own operations. So we do not, we have a partner affiliation with Avera out of Sioux Falls, but we also have a lot of local autonomy in how we make decisions here locally. And that's a big piece for our community because everything that we do is reinvested back into the community. And I think it's been a huge part of our local success here at Floyd Valley.
Can you tell me a bit about why the child care center came to be and what made that felt?
Yeah, as a community, we realized that there were significant needs within the child care space, and I think that's common in the state of Iowa and across the country. We had conducted a study with through and funded by Lamar's Business Initiative Corporation. That's a group of business owners, operators, a core contingent of community leaders that came together and realized that we've got a daycare problem. If we're going to grow the community, recruit families to come in, we've got to have a way to take care of these children. So we conducted that study, was part funded through Lamar's Business Initiative Corporation and Lamar's Area Betterment Foundation, and found that there was a significant shortage. We knew that there was, but then understanding with the public-private partnerships in the community about to the extent that in-home and child care center daycares that were existing at that point in time, which was about 3 years ago, what the capacity was going to be. And it became pretty clear that just based off the growth with existing providers that we were going to have to take some additional measures to try to help meet the needs of the community. And that further kind of led to looking into one, either building a new daycare, or two, was there a property in the community that we could acquire?
And what was the timeline for that, for planning and developing
Yeah, so we had that study done, must have been around the 22 timeframe, and then 23 was active planning. We formed out of Lamar's Business Initiative Corporation. There are a group of individuals and some other community members that formed the Lamar's Community Daycare Center. That is now a 501c3 not-for-profit organization. And then the group within Lamar's Community Daycare Center started meeting on a regular basis to really dive into the issues that we were seeing and realized that it was probably going to be feasible to try to purchase a property. There was an existing daycare in the community that Lamar's Community Daycare Center is now located at. We worked with that previous owner. We were able to purchase that building. And one of the key things that came out of that, through the purchase, we realized that margins in daycare are really tight. So being able to make that work, we wanted to try to find an innovative solution. So midway through 2023, we started a capital campaign and we raised over $3 million in less than 6 months.
Wow.
Completely paid for the building and worked through a request for proposal RFP, and that's how Crittenton Center got involved. We knew that the need was there, but none of us were really in a position to have the day-to-day oversight of the building. And from an operational agreement, we worked with Crittenton Center, and they opened Lamar's Community Daycare Center, operated by Crittenton Center, based in Sioux City, Iowa. When they opened that building, there were less than 30 children in it, and now there's over 100 in
Wow.
1 year time span. But that model of having an operational lease in place, Crittenton Center does not pay any rent for that building right now. They will in the near future, but we had to get a proposal in place for them to be able to get their feet on the ground, get established, start to generate cash flow, and really build a presence in the community that we thought was going to be sustainable long term. So
Once they were open, was there any other cash flow that helped prop this up?
yeah, well, we knew at the onset that there was going to be some deferred maintenance and things we needed to take care of. And so we built that into our fundraising efforts. Lamar's Community Daycare Center did take out a loan on the front side of this just to get the operations moving. So we're since working on that. As we get contributions in from the capital campaign, we'll get that note 100% paid off in the near future. And then at that point, there's going to be some maintenance type things, but it's our hope that Crittenton Center is going to continue to grow their presence here, and they'll be able to, from a cash flow position, be in a standpoint where they can start paying some rent back to Lamar's Community Daycare Center board organization, and we'll be able to continue to grow that presence locally.
How has that impacted the community and also specifically Floyd Valley?
Yeah, in a major way. You can talk to, I think any employer in the community would tell you that that work is absolutely critical. If we're going to continue to grow the community, grow businesses, the best way to do that and getting people to move into the community is it's, I think, a multi-pronged approach. But daycare is definitely a piece of that it's got to be accessible, and it cannot be a struggle to find what you're going to do with your children. And what we found in the survey back in the early days of completing community-wide survey was that there were a lot of people that preferred to be in a licensed daycare facility versus in-home, and absolutely nothing against in-home daycare, because I think that is a wonderful option. We just saw during the survey that there were people that were preferring to be in a licensed facility that didn't have that option. And so when we got that turned around, we saw that volume increase right away. Since that point in time, we've had people move into the community that have commented that it's a great thing, that they trust it, that it's easy to make that transition. And locally for Floyd Valley, we have a heavily based female workforce. And so for us to be able to continue to grow our operations, bring new professionals into the community, we have a lot of young moms that work here, young families. And for us to be able to tie that in, it was really critical, and it's been a huge part of our success locally. And it just, the entire continuum works really well when families can not have to stress about daycare and being able to focus at work. And obviously there's a huge productivity piece that goes into that as well. But just the recruitment, retention, all of that has pulled in nicely, and we have a number of employees that use that facility now.
Can you speak a little bit more about how the center has impacted your ability to recruit and retain? You mentioned focusing on, or maybe not focusing, but how this impacts young families. Is that a particular selling point when recruiting?
Absolutely. You know that there's immediate access because they're still accepting kiddos. And two, when they walk through and see the investment, and that facility has all brand new equipment now, it really speaks for itself. And I think when you're talking to potential new team members, employees that want to join the organization, it eases their mind, and you can kind of move past that barrier to realize that if my family's going to be taken care of, I can really focus in on what it's going to mean from a work perspective. If you don't have that, and there's not that availability, people just are not going to look to make that type of transition. I mentioned a little bit about the productivity standpoint, but it also has just a big impact from reducing the amount of sick call days that team members have, not because they're sick, but their a kid in their family is that they have to take care of. And we've always strived to be a family-first organization, so obviously we do everything we can to make that work. But when there's a consistent approach in daycare that can help kind of navigate and bridge that gap for us, it's a big difference. It makes for us being able to deliver patient care on a consistent basis too.
How does this impact staff that don't necessarily work a 9 to 5?
Mm-hmm.
Are there additional options, or is that a current challenge?
Yeah, it's still a challenge. They do open early, and I believe the last pickup time is around 6. Don't quote me on that. It's right in that range. But it makes it easier, but that, I would say, is still something that we're always navigating. Historically, for our team members that are working, obviously we're a 24/7 operation. Mm-hmm. Our team members are working those overnight shifts. A lot of those families have plans in place, and that is why some of our nurses specifically work the overnight, because another significant other, spouse is home, family member can take care of the kids, and then they'll come home, can sleep during the day, kids are at school. So there's some balancing things that we can make work. But that still, I think, is a challenge that we have to navigate and try to continue to work on.
Fantastic. Are there additional challenges that have come across since the Child Care Center has launched?
You know, we've been really fortunate that just a massive amount of credit goes to the Crittenton Center and how they operate that facility. Very reputable, they do a good job. Long term, I think our biggest challenge is going to be the growth that we continue to see in the community happening right now. And that building will hit a capacity at some point. I guess what I've seen over my close to 7 years in this community is that when there's a need, it gets done. And people step up, they make it happen. And I don't think that's always the case in every community. And so for us, that is really a unique contributor that I guess I would kind of say is the secret sauce of how we continue to be really unique in the things, and a lot of people are working in the same direction.
Fantastic. Moving into thinking about how we could replicate this across the state, tell me a bit about the lessons you've learned or best practices that you've utilized within this initiative to help share with other hospital systems who want to replicate.
Yeah, I think it was absolutely key. The component where we acquired the building and had a no lease built into that operation for what we were looking at was a 3-year time period, and having a little bit better understanding of the financials and how a daycare operates. I think that was really critical, because when we got Crittenton Center to come in as a partner, a lot of organizations just don't have a lot of extra capital or capacity to expand operations. But we really took it upon ourselves that we were going to have a major stake in this. We just didn't want to be the day-to-day operator, but that would be the number one thing I would say, is that if you can get the community to support the dollars, get a building in place, and work with an established operator and help them get their operations in place with limiting their overhead exposure, I think you can replicate this model and make it work. can happen with that, and that's what we've been able to replicate in this community time and time again.
I suppose that's worth another question, is how did you find your key people, the stakeholders to bring
That is a good point. So within Lamar's Business Initiative Corporation, that group meets on a monthly basis.
Mm-hmm.
There were a number of folks that knew that this was a major impact in the community that probably were personally vested into it. At that point in time, I had just my wife and I had just had a little baby, and so we knew firsthand how challenging it was to locate daycare facilities, the availability of it, and so it was personally impacting me. So I felt really passionate about it. But then from an employer standpoint and knowing our workforce, what that was going to mean for the community, that led the group to volunteer, to come forward and really just start leading that initiative. But there are so many great providers in the community that are doing such a great job that helped us on this journey as well. We just knew that a number of those providers were more or less maxed out on what they were going to be able to do, and we felt that there was that additional need to help supplement the community. But I just want to make sure that we don't discredit the great work that's already being done by so many great in-home and facility daycare providers in the community right now that really make a huge difference and for all of us.
Absolutely. It's not, we don't want to frame it as a competition. You were meeting a need that the community had.
That's exactly right.
Absolutely. Any additional key takeaways that you would want others, those that are watching, to learn if they want to?
Yeah, I think, just getting started and making sure that can sometimes be the hardest step. Mm-hmm. And we utilize data to try to help drive some of those decisions that we were making. But then after a while, it really just takes the dedication and drive to see it through.
Similar question asked in a different way. If you were to do this again, would you want to change any aspect of how you went through the planning process for this?
I don't think so. We were fortunate that we had a building that was already set up as a daycare center, mm-hmm. and we were able to acquire that from the previous operator. I think it would have been a little bit more challenging to build it from the ground up, mm-hmm. but we were prepared to do that. And we probably would have had the same result at the end of the day. It just would have taken a little bit longer. Mm-hmm. So I think that would be a variable that other communities might have to navigate. But for us, I think we're all pretty proud of how this played out, and nothing really comes to mind that we would change as we were working through this.